The last decade has seen a massive investment in the NHS. Funding has now risen to more or less the European average. And yet, whilst this has brought much needed new hospitals and equipment and many new doctors and nurses, it has not significantly improved what is most important of all, and that is health outcomes. Traditionally, governments of all colours have made the mistake, I think, of thinking that the best way to deliver healthcare was through some degree of central diktat, that ministers in Westminster and officials in Whitehall, by definition, know best. Well, speaking from personal experience, I know that that is not so. GP commissioning is a new approach to the design and the delivery of healthcare. It's about understanding the needs of a local population, of groups, of individual patients. It is about working with patients and with the full range of health professionals to agree and to design the services that best meet those needs. It's about creating a clinical blueprint that forms the basis of contracts with providers. And it's about holding a range of contracts to offer choice for patients wherever possible, and monitoring those contracts to make sure that services are delivered to the right standards of quality. Our proposals for GP commissioning will push decision-making much closer to patients and much closer to local communities. And they will ensure that commissioners are accountable to patients and communities in a much more direct way. It is the GPs on the ground who are best placed to lead, for it's GPs who see patients with every conceivable ailment on a daily basis. It's GPs who navigate the system every day on behalf of their patients. And so it is GPs who we will empower to lead and transform the system in conjunction with their professional colleagues across primary, secondary and community care. They will work with other professionals to design joined up services that make sense to patients and the public. The government believes that power is something to be given away and not hoarded at the centre. Local services should be accountable to local people, working in partnership with local authorities, with the local health watch, with a whole gambit of professions across the local health economy. GPs will be able to design better, more responsive and more accountable services. At the moment, it is the job of primary care trusts to commission services for their communities, and some PCTs carry out this function with great skill and efficiency. I visited one of those last week. But to be frank, overall, the quality of commissioning has been poor, and certainly it has been inconsistent. By 2013, the power to commission most NHS services will shift from PCTs to consortia of GP practices, supported by the NHS Commissioning Board. Of course, the real challenge will be moving from one system to another. During this time, PCTs will have a crucial role to play in supporting GPs, sharing best practice, helping them understand some of the challenges that commissioning services will bring. But supporting GPs is not the same as leading them by the nose. It is for GP practices to come together and form consortia, and it is for consortia to decide how they will organise themselves. PCTs will be invaluable to that process, but I think it's essential that the process is led by general practice and not by primary care trusts. At the same time, this isn't about practices being left on their own to fend for themselves. Effective GP commissioning will only come about when there is the full range of professional input. Now, GPs clearly have clinical expertise, and they also have the power of referral, and they're very trusted individuals. But I hope that all GPs would agree that to design and deliver complex services that meet the needs of local people requires an effective partnership with other healthcare professionals, including nurses, allied health professionals, and hospital doctors. They all have a role to play. Now, we're not going to tell consortia how to organise themselves. Some may take commissioning decisions collectively. For instance, adopting a lead commissioner role could be a good route for contracting with a very large hospital trust or an urgent care provider. But other consortia may decide to do things differently. Consortia will decide what commissioning activities they undertake themselves and which they choose to buy in from outside. Local authorities, private or voluntary sector bodies are all in a position to help them commission effectively. We don't favour one sector above another. That decision is one for consortia. Rather, we favour a truly level playing field where the only determinant of who provides a service is the quality of the service that is provided. We will do all we can to ensure that conflicts of interest never interfere with the delivery of high-quality healthcare. There is no set model. Consortia are going to evolve and grow organically in the interests of their patients. So when we get down to the minutiae of organisational structures and oversight mechanisms and financial management, which we must, let us always keep in mind the reason that we are reforming healthcare in this way. It boils down to trust. The government trusts the men and women of the health service, and we believe that by trusting them, by trusting you to organise your healthcare, we will see markedly better outcomes for patients. I hope that this is the moment when GPs and their colleagues throughout the health service have all been waiting for. What our proposals amount to is the bringing together of clinical decision making with the power to decide how money is spent. I think that putting those two things together provides an extremely exciting prospect for the health service. Many doctors I've spoken to have in one way or another described their frustration at how the system sometimes gets in their way. They want to act in the best interests of their patients, but for whatever reason they can't. I hope that the new system of GP commissioning will change that. I hope that the end result is not only more cost-effective care, but also better care. That's what all this is about, raising our game as a health service. For over 60 years, the health service has been valiantly taking on Beveridge's giant of disease. It has overcome considerable odds to improve our nation's health really beyond recognition in that time, and it will continue to do so for the decades to come. Yet from now on, it won't be ministers like me in charge of that process. It will be patients, and it will be you, the professionals, who are calling the shots. Thank you very much.